if somebody were to approach me and say, hey, you know, our paper log's fine, I've never had an issue with it, this VetSnap's out there, you know, have you used it before? I would strongly encourage them to switch over. There's no reason not to switch. I'm Dr. Jesse Brown. I'm an emergency veterinarian. I'm the medical director at a little off-hours emergency clinic in Gainesville, Georgia. We're an off-hours clinic, so we're not open during the day on the week, but we 24 hours over the weekends. We're catching transfers for critical care overnight from the local day practices, and we also tend to, you know, true emergencies. In the ER setting, you're of course nothing's scheduled, and so you're having everything hit you as it comes in the front door. So you're in the middle of a GDV surgery and you got hit by a car that comes in. If anyway, these things all add up, and so it can make controlled drug logging a chore. But the problem with the paper log is it wouldn't be uncommon to put the wrong drug on the wrong page. Then you got to go in and mark it out, initial it. You can't erase it. If somebody forgets to log some things in, you go back 2 or 3 days later, then it's out of sequence, and if you've opened a new bottle, now you've got to go back and deal with that. So VetSnap allows you to do that without having a messy log. Really nice thing is on an individual patient, you've done a pre-med with midazolam and whatever else you decide, maybe a little Tilazol or something like that. You go 1, 2, 3. Instead of having to flip through 3 different drug logs, you can go 1, 2, 3 on that one patient, and it just like that puts it all down there. That's really awesome. The support that we got was awesome. You know, you could say I got a problem, they come in and do a team thing with you, and you could face to face is 10 times better than a phone call. I mean, I could hold the thing up to the thing and they could look at it, you know. But I think overall our doctors, after they got just used to the change, they appreciated that change and wouldn't go back to a paper log. I think the one thing that I've appreciated with VetSnap, that over time, they responded to issues that came up. The program doesn't make a big deal out of making a new version, but you notice over in the corner that, you know, oh, they've updated it again. So they're keeping up with stuff as they're going along, which I like. I would say as somebody that's been doing this for 25 years, especially with the emergency thing, I think it's one of the biggest innovations that I've seen as far as just software goes. I like it.